Yeah.
Right. So let's talk about the complexes and intervals. Then we're gonna incorporate the ECG into all of this. So some of the stuff I'm gonna mention is literally like a recap of the last class, but I kind of dive into it a bit more, as well as showing some ECGs, right? So the first thing we encounter on an ECG is the P wave. Because remember, your pacemaker is in the right atrium, right? So it starts off the rhythm, it starts off the electrical activity. And therefore, your P wave, that upward deflection you see, is going to represent depolarization along your atria. So I'm moving fast here because we already went through this. But again, if I lose you, stop me at any point in time. So that's what the P wave represents. It's important that you know all the meanings are, you know, what exactly each wave represents and what each interval represents. They can ask you things of that nature, like what does this wave represent, or which of the following refers to this particular interval, or such and such. So you'll see that as I dive further down. For you to read and so Ryan, I was saying, ensure you know what each wave represents. So ensure you know what the P wave represents, the QRS complex, your T wave, etc. Wait, what sound? I'm confused.
Hear like a buzzing, whirring sound.
A buzzing sound?
Yeah.
Are you guys still hearing it?
Yeah.
Okay, that's weird. Wait, I wonder if it's the microphone. One second. Is it any
Well,
better?
almost sounds like an electrical buzz or something,
Yeah, I think it's
which
probably
is
the
kind of
microphone.
funny because you're talking about ECG.
Yeah, that's kind of weird. Wait, Nick, is it gone? Guys, is it gone? No.
Not from me.
Nick says it's gone.
Nah, I'm
I wonder
still
if it's
hearing it.
Zoom.
Still hearing it.
Is it distracting, guys? It's probably
Personally,
distracting.
no. It's not really distracting me, but
Oh, okay. Okay. All right. Cool. Yeah, I'm not sure why that sound is there, but anywho. Right. So your P wave, right? Oh, okay. Okay. Yeah, I guess I'll check that out. I'm not sure what's causing that. But yeah. So your P wave, guys. So remember it represents atrial depolarization, right? You have to know the duration of a P wave as well as the amplitude of a P wave. Why you need to know it? When you're interpreting ECGs, you're actually required to know these two things. The P wave is important because it helps you to determine if you have a heart that's beating at a regular rhythm or not, right? So whenever you're interpreting an ECG, you have to assess the P wave to see if the duration is correct, right? And remember, you're going to assess that duration by using your x-axis. Does anyone remember what one small box on the x-axis represents as it relates to seconds? Not sure? 0.04. Absolutely. So what that means is, when we actually look at an ECG, a P wave, it could be like 2.5 small boxes, right? Could be like 2.5 small boxes if it's a normal P wave. Follow me? And at 2.5 small boxes would be equivalent to about 0.10 seconds, if I'm doing my math correct. So yeah, so that's a P wave. So like when we look over here on an ECG, for example, oh gosh, Zoom makes it terrible. Yeah, it does have a range, Sean, but so basically, how I learned it was it's best to just think about it as less than 0.12. I mean, in your lecture, you probably see something saying 0.5 to 0.10 seconds, or you might see 0.6 to 10 seconds. Like the ranges vary. So it really varies, right? But what they told me on emergency medicine when I was there was they were like, you just remember it as less than 0.12 seconds, and you kind of can't go wrong. So that's why I put it like that. Amplitude as well has a range. Amplitude should be somewhere along the lines of 0.05 to 0.25 millivolts, right? So there is a range, but I just put it like this because it's kind of easier for me to remember. So, I mean, if you guys are studying, you can remember your range. But if you want a shorter hand way of remembering things, you can think about it like this. So I'll edit the slide, you know, to your comfort as well. So this would, for example, be like 0.6 to 0.10, for example, in your textbook. But again, like it varies from literature to literature. So I just found it more convenient to remember it like this, really. So yeah, so that's the thing, right? All right, good. So when we look at our ECG, we can actually appreciate P waves. So whenever you start looking at an ECG, my number one recommendation is always to look first at this strip right here, right? You always look at this strip right here. This strip that I just highlighted, let me know if you guys learned it in class, please. It's called the rhythm strip. Did anybody remember that from class? Okay, great. So this is the rhythm strip. It's a very important strip on your ECG paper, right? And I'm gonna come to it, but basically when you first start looking at a 12 lead ECG reading, look on your rhythm strip first. So here we can see P waves. Like we see a P wave here. Well, no, that's not a P wave. That's a T wave. My bad. We see a P wave here. We see the QRS. We see a T wave. P wave again. QRS, T wave, P wave. Right? That's a rhythm strip. Right. And if they don't show the rhythm strip, you look at lead 2. So that's correct, Nick. But usually, they usually always give you a rhythm strip. Maybe not for like your cardio exam. Maybe they don't show you like a full 12 lead ECG. But whenever you read an ECG, you should always have a rhythm strip. Like it's literally mandatory to have a rhythm strip, right? But yeah, so always use a rhythm strip. Look at the rhythm strip to identify P waves. So I just pointed out a few P waves for you guys so you could appreciate them. P wave here, P wave here, P wave here, right? So we're gonna actually come back to it, but I'm just showing you guys the components of the ECG before like I actually dive further. And then immediately after a P wave, right? You have this isoelectrical line or a line that doesn't have any deflection. That's what they refer to as isoelectrical line. So the point from the start of a P wave to the end of this isoelectrical line is referred to as the PR interval, right? And it's basically this period where the atria depolarize, as you can see right here, P wave atrial depolarization, right? This isoelectrical line that you see, this purple area, this is actually showing conduction of the electrical impulse from the atria, right? So here we have the atria. Electrical impulse moves from the atria to this little bulb area, which is called the AV node. Moves from the AV node, goes to a bundle of his, and all that jazz. So that conduction of electrical impulses along this area, right? To your Purkinje fibers, which are these little branches, that isoelectrical line represents that conduction of electricity, right? So isoelectrical line is showing the conduction of electricity along those areas from AV node to bundle of His, right? And then straight up to your Purkinje fibers. That's the isoelectrical line. So obviously then a PR interval is going to encompass atrial depolarization as well as conduction through the AV node, bundle of His, and the Purkinje fibers. ensure that you know this. Ensure that you know what everything on this ECG plotting means and its correlation to the heart. Trust me, right? All right, cool.
So to
You have
clarify,
to also, Yaron?
yeah, so to clarify, the PR interval is from the start of the atrial depolarization to when it reaches the end of the bundle, but the bundle branches.
Yeah, when it reaches the end of the Purkinje fiber.
Purkinje fibers, okay.
Right. And the time for all of that to happen is this range, 0.12 to 0.20, right? You have to ensure that you know this range as well, because when you actually assess an ECG, you need to ensure that your PR interval, which is this thing right here, you need to ensure that it falls within this duration. Now, normal instances where this PR interval can change, because what I'm doing today is I'm doing normal. We'll talk more about like abnormal and getting all those details further down. But we'll have to appreciate the normal thing first, right? So here we have it. The PR interval, it can actually decrease or increase based on the heart rate, right? So it can increase or decrease based on heart rate. So if your heart rate is high, so high heart rate means a short PR interval, which makes sense because remember these little plottings, they're gonna move faster on the ECG if your heart rate is high. So that's why the PR interval is shorter when the heart rate is high. And of course, if you have a slow heart rate, you have a long PR interval. So the PR interval is affected by heart rate. You can have a normal physiological shortening of a PR interval. For example, if you're walking on the road and a gunman creep up behind you, you know, like your heart rate start fly off the roof, you know, epinephrine kicking and all of that jazz. And as a result, the heart rate increases, PR interval shortens. In a similar fashion, if you're relaxing at home and you're not doing much, you know, you have increased vagal input, so heart rate slows down, longer PR interval, stuff like that. So ensure that you know this duration as well, right?
All right, another question. Sorry
Yeah,
if I
sure
keep
thing,
interrupting,
Ryan.
but the PR intervals. So why is it called the PR interval instead of like the PQ? Because isn't the R the top of the QRS complex?
Right, exactly. So that's a good question. But essentially, the reason why they do it and the reason why they call it a PR interval, kind of slightly confusing with the name, right? But some leads on this 12 lead ECG will eventually see, I'm not going to show it right now, but some leads on this 12 lead ECG, they don't show a Q wave, right? So you see how this Q wave is clear cut? Some leads on this ECG, they don't show any Q wave at all. So because of that, you can't appreciate a PQ interval. So that's why they just dub it a PR interval. Yeah, so it's like a misnomer. So that's why they dub it a PR interval to imply that the line stops wherever the QRS starts. So if the QRS starts at an R wave, that's where the PR interval is. If the QRS complex starts at a Q wave, then you know that's where you have the PR interval. So it's a misnomer, but it's not a misnomer. Hopefully you guys get that, right? Ryan, you understand that, right? Yeah?
Yeah, I get it.
Okay, good. All right, cool. Okay. So that's a PR interval, right? And again, we'll come back to this whole QRS complex. So remember, a QRS complex, since we're now at the point where the electrical impulse is at the Purkinje fiber, what comes after Purkinje fiber? Muscle tissue, the cardiac tissue. The inner layer of the heart is the endocardium, right? Endo for in. So that electrical impulse is going to pass along this direction. Very important, so jot it down. Depolarization in the ventricles pass from endocardium outward to the epicardium, right? So it moves from Purkinje to endocardium to myocardium and lastly to epicardium. And then the heart contracts, right? And this depolarization from endocardium to epicardium is what this QRS complex really is, right? So the stuff on this diagram, I already mentioned it, but I'll mention it again. Okay, yeah, sure thing, Marsha. So I was saying, remember here along the PR interval, right? We had the electrical impulse pass into the Purkinje fibers. The Purkinje fibers then move the electrical impulse to the inner layer of the heart, which is the endocardium. And then the depolarization continues further along this direction that you see the arrow to go to your myocardium and your epicardium, right? So depolarization goes in that manner. So that's something important to know as well. The depolarization moves from endocardium to epicardium. And it's that depolarization that gets registered as your QRS complex that you see right here. So in a QRS complex, the first downward wave that you see, it's always the Q wave, right? And a Q wave is always followed by an R wave. So you'll always have an R wave right here. So first downward deflection, Q wave. And then the next positive deflection that should always follow is an R wave, right? And then the downward deflection that follows after that is your S wave. And as I mentioned, some leads, they might not have this Q wave at all, but that's normal. And when we look at some leads, what you're going to find is that this QRS complex doesn't look so clear-cut and nice and pretty, right? So I'm going to show you guys very shortly. You need to know the duration of this QRS complex. To be honest, it's kind of hard to show it on screen, but I'll try my best. But essentially, the duration of your QRS complex is within this range, 0.06 to 0.1 seconds, right? You need to know the voltage as well, 0.5 to 3 millivolts. So all these things are important to know when you assess the ECG. So you actually have to look out for these things as you assess the ECG. And I'm gonna walk you guys through all the steps in a bit, but we're just going, through all of this to get to the ECG part. Okie dokie. Good. So assuming everyone has that down, or you guys are getting the slides anyways. So let's look at this thing. So when we look over here, right? We see a bunch of leads. We see 12 leads. Let's look at the rhythm strip first. I just want to show you guys something. We're not actually reading an ECG yet. I'm just showing you guys something. We're looking at the rhythm strip. Let's start here. This is a P wave. The first downward deflection is a Q. Then the upward deflection that follows is the R. Downward deflection again.
Yeah. 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 Yeah.